Hello everybody and welcome to today's edition of Facebook Live here at Henry Mayo Newhall Hospital. My name is Bud Lawrence. I am the emergency room medical director here at Henry Mayo, and I'm an emergency room physician. And we're here today to talk to you about a few things, but most notably we have Dr. Dortha Chu here, who's a breast surgeon, and she's going to be here to share some of her wisdom and educate us a little bit about breast surgery and other items that are somewhat related to our COVID-19 outbreak. Before we get started though, I do want to mention a couple of things. One thing that's very important, a group of people that is so important to our hospital are volunteers. This week is Volunteer Week, and I just want to send a big shout out to them for all of the great work that they have done. I know that some of them are at home right now, not here volunteering because of we don't want to expose anyone to any risk, but we are so thankful for their help and we appreciate them. If anyone does want to volunteer here at Henry Mayo moving forward, please contact our hospital to get in our volunteer program. It's amazing, it's excellent, and it's a great service to our patients and our community. Another piece that I wanted to bring up is that people have always asked for numbers, so I kind of want to update how many people have been discharged here from the hospital. We today we're right at about 27 COVID-19 patients who have been discharged home to resume their usual activities. It's a great thing. We're very happy for that, and we're very thankful. And one other little piece, as you'll see on the national news outlets and local news outlets, that there certainly is a push now. We're recognizing that our chest pain patients, our heart attacks, our strokes, our appendicitis patients, and other emergent patients are not showing up in our emergency departments. This is not just here in Santa Clarita, this is nationwide. So we really want to reinforce to you. We sent the initial message of stay home, but we want to take a step back and sort of re-say this or rebrand this, that we think it's very important that if you had something that you would have otherwise gone to the emergency room for, we don't want you to not pay any attention to that. We want to make sure that you are treating that appropriately, and what we would recommend is either call your physician or know that our emergency department is open and it's a safe place to be. Our staff are wearing masks, patients are wearing masks. There's not much to be concerned about, and we're here to care for you, and we're here to serve our community. So enough about me. I want to talk to Dr. Chu. Thank you so much for joining us today.
Thank you so much for inviting me.
Absolutely. You are a breast surgeon, is that correct?
Yes.
So tell us a little bit about what you do and how this COVID-19 pandemic has been affecting your practice and your patients.
So I'm a breast surgeon with City of Hope Cancer Center. So most patients that I see are cancer patients, breast cancer patients, although I do see some high-risk patients as well as other more complicated benign diseases as well. And it's been an interesting time because obviously there's a lot of concern with patients who have a cancer diagnosis, both in terms of the urgency of their personal diagnosis, but also the fear of either being exposed to COVID by seeking treatment, or is it safe to delay their treatment? So we've seen a little bit of both. We're still open for business, so to speak. We're still doing treatments at our facility for patients who need chemotherapy. We make sure that we practice safe distancing. We're making sure that everyone's as safe as possible, but we're still treating patients who need to be treated. We're still doing surgeries for patients who need to have their surgery sooner rather than later, so that's still something that we can arrange for and we're still doing. But there are some patients that maybe because they have other health issues or other risks, that this is not the safest of times for them to be in the hospital setting where they may be exposed, then we've developed alternative treatments that can at least make sure that they're safe during this period if their surgery has to be delayed temporarily.
That's great, and so it's good for us to know that there is a strategy behind this, and it's all very well thought out. You mentioned that some patients it's okay to delay, and some patients it's not. We have a breast center here on campus, the Sheila Bellows Breast Center. How should our patients be utilizing that breast center? In terms of things they need to get done now and maybe things that can be put off?
Absolutely. And that is one of the great jewels for our community is the Sheila Bellows Imaging Center. They have done a fantastic job as far as making sure that we have the right kind of screening for patients, for just general for breast cancer, as well as diagnostics if they do have something of concern, and follow-up too, as we do surveillance later on. Right now, of course, because of the pandemic, there are limited hours at the moment in terms of what's available for patients to be able to schedule a study. We are temporarily halting routine screening mammograms. So this would be someone who's just due for their annual mammogram, but otherwise have no physical changes, no complaints, nothing's different, and they're just going in for their mammogram. Those are temporarily delayed, and my encouragement would be that once we lift the lockdown and the hours become more open, that they obviously should resume their screening and make sure you call Sheila Vilos and schedule your appointment. And if you need the phone number, it's 661-200-1099. So I definitely want to encourage you to call them and schedule your appointment. But for those who do have something specific, if you do feel a lump that's changed, different or new, or if you notice any skin changes that's new, like redness that doesn't go away, the skin feeling thicker or harder, looking like it's being pulled in from the inside, any of these kind of changes, or a discharge that's more blood-like, so red, thicker than just water, those could be something of concern and should be evaluated sooner rather than later, and those are not being delayed. So if you do have one of those kinds of symptoms, don't panic. Most of the time it's not cancer, but it does need to be evaluated. I would recommend starting with your primary care doctor so they can at least put in the order for you to have what's called a diagnostic image with Sheila Vilos, where they will specifically look at those complaints. So that's all being done, and it's being done very expeditiously. So I do encourage you, if you do have a complaint like that, to make sure that you do contact them for the right imaging. Otherwise, if you don't, like I said, it's okay to wait a month or two until we're sort of past the immediacy of the pandemic, when it's a little bit safer for everyone to come in for your routine test. Even if there is a problem that's early enough where there's no physical signs, a delay, so to speak, of a month or two is not going to change your prognosis. We're still going to be able to catch it and fix it. So don't panic if your mammogram is delayed by a month or two. But don't let it be delayed much longer than that once we open things back up for normal business.
So basically what I'm hearing from you, that the take-home message is that if there is something that you sense that's a problem, don't put that off. And
Absolutely.
That's correct, right? And I think that's something that kind of is a broad statement amongst all patients and amongst all specialties, is that many of our physicians in this community, from pediatrics to neurologists to breast surgeons, their offices are open, sometimes with limited hours, sometimes with telehealth. But what we don't want is, we don't want you putting off something just like the emergency department, where you could have otherwise been seen and had something taken care of. We want to make sure that you are following that up appropriately with your physician. We also, you brought up the fact that patients who are just going in for routine testing, those patients, you wait till the pandemic's over and then you can catch up. That's basically the take-home message. I think that's really important for our community to understand. That's a really, really good point. Now, you're in a somewhat unique position that oftentimes you brought up the word cancer, you're taking care of patients who have cancer. Those patients have really sometimes very specific needs in terms of their immune system. You brought up social distancing and that the people in the office are aware of how to manage that. Your statement, you'd say, is that it's safe for patients who are cancer patients, a question that we've gotten multiple times in the past. They can go see their physicians?
Absolutely. So in fact, that's a question that just came up too. Should breast cancer survivors take any precautions? So I will expand on, I would say both, whether you're a survivor who is currently on maintenance therapy or you're completely done with your therapy, and this also goes for other cancer patients as well. We monitor your blood work very closely, as you all know, if you're on therapy. And so one of the things that is routinely looked for, whether there's a pandemic going on or not, is how robust is your immune system. And for the most part, if your immune system is robust enough, and that's again reflected on your blood work, then your immune system should be able to protect you as well as anyone else, as long as you're taking the proper precautions that we all are taking: social distancing, wearing the masks per recommendations, etc. So there's no additional precaution you necessarily have to take. Having said that, if you do have some compromise to your immune system, your doctor would tell you that, your cancer doctor would tell you that, and then you may then at that point definitely want to take a little bit more extra precaution. For example, definitely stay home more. But in general, I would say if you're taking the same precautions as everyone else, your safety should be fine. It should not be impacted whether you're on active treatment or not.
So that's very telling. So if you're saying that cancer patients, even if they're undergoing treatments and most of these patients are safe to come to see their physician, it would be safe to assume that if you weren't a cancer patient and you were a quote-unquote normal patient that does not have a compromised immune system, that it would be safe for you to go see your physician. That shouldn't be something that should be a concern. Is that correct?
Absolutely. And then just like with everyone else, most primary care doctors' offices, as well as for us at City of Hope, we've now established various types of either telephone conferencing or even video conferencing, which we're in the process of installing. That gives you an opportunity so that when you call into the office and let us know what's going on, we can talk about, is this something that you need to physically come in, or can we do some things proactively or sort of before you even have to come into the office to minimize your need to actually physically leave your house and come to the office to talk to us. So it definitely is worth at least reaching out to your primary care doctor's office, or if you are a cancer patient, reaching out to your cancer doctor, again, whether it's with City of Hope or any of the other fine institutions and groups around the area. They have systems set up to be able to address your question. So definitely reach out to us, let us know what your concern is, and we will do what we need to do to make sure you're as safe as possible.
That's great, and I do think that it's important to bring up this telehealth piece, telemedicine. Many patients, you might think about it and not be so comfortable with the fact that you're speaking to your physician over Zoom or some other platform. The reality is that this is somewhat the new normal at this point. We really have to embrace this technology and leverage it into how we as a community can be as healthy and as safe as we can. And if this is an ability for us to have an interaction with our physicians and to have that visit without having to get out in the community, this is something that it saves you drive time, it saves you waiting room time, all these things. There are many benefits to it. I think it's important that we use it as a proper access point into the healthcare system. And I think that it's a very valuable tool. And speaking about access to healthcare, I think a really important point, which should be brought up, is very exciting with Henry Mayo, is that Henry Mayo, I know it's exciting to you, we talked about this before.
Yes.
Henry Mayo has just finalized a contract with United Healthcare, which is an insurance that many people in our community have. And this means that you can come to Henry Mayo and get your care if you have United Healthcare insurance. I know this was an issue before. There were some challenges to get the contracting in place. A lot of hard work done on both sides, and now we do have that. So that's a very important point. Let your friends know, and it's something to look forward to.
And if I may add,
Absolutely.
because this is sort of a changing landscape for all of us, insurance companies now are recognizing that as well. So a lot of these telephone visits that you have with your doctor, they're covered under your insurance. So that don't be afraid that because that you're taking advantage of that new technology, that's somehow going to be a financial burden. It's no different than what you're used to as far as having an in-person visit with your doctor. So it's a good substitute. It may not replace all of your visits, because sometimes that physical examination is still important, but at least it gives you that opportunity so that if you do not have to leave the safety of your home, this is another way to be able to at least get the health care and the evaluation that you need.
That's a very, very good point. And we should say too, I think probably people know that the governor of the state of California has opened up for elective surgeries, plans to move forward with that. Of course, that directly impacts Dr. Chu and her ability to perform her art of surgery. So we're very looking forward to her taking care of her patients as well as the rest of our surgeons. So if you had a surgery that may have been scheduled before and this got delayed because of the COVID-19 pandemic, I'd recommend that you get back in contact with your surgeon, because there are preparations being made to reopen our surgical lines so that we can take care of those urgent patients. Maybe you had a gallbladder that can't be taken out, or a knee replacement. Recontact your physician's office. Perhaps sometimes the approvals for these surgeries may have expired and there may be other things that need to be done. We want to get people back in the tunnel to get their surgeries done so that we can get you happy and healthy and on your way. So, Dr. Chu, I want to thank you so much for sharing your expertise with us and taking your time.
Well, thank you very much for inviting me. I had a great time.
That's great. And we want to wish you great health, and thank you again for doing your part to stay home. Remember, our emergency department is open. This hospital is here for you in all ways, and I feel that we are very prepared to take care of anything that may come. Please stay healthy and stay safe. Thank you so much for joining us today.
Thank you. Bye.